previous years. We have faculty more than 70. We have almost 400 abstracts. I think as far as the whole meeting is concerned, I have the impression that if you look back, we were on the right track regarding the evolution of oncology, not only in the purely medical, but also in the multidisciplinary part of it. So I welcome you here, and I think if you have any questions, we will try to answer them after the three of us have done their presentation.
Good morning also on behalf of myself. So I'm Erik van Kutsum. I work in Leuven, Belgium. Happy to have you here also, and happy to welcome you also for this 20th meeting. You probably know a little bit of the history. We started in 1999 with a small meeting in Geneva, between 100 and 150 participants. So as Mario said, the meeting has grown to now around 3,500 people. So Geneva was the first year, and this was a meeting only focused on colorectal cancer. Later on, we expanded 5-6 years later to different GI cancers. 1999 was Geneva, then was Barcelona, then 2001 was Dublin. And from 2002 onwards, we decided to have the meeting here in Barcelona. And then later on, we have had an agreement and a collaboration with ESMO. And so the name, initially the Congress was called Perspectives in Colorectal Cancer. And then we changed through the evolution towards ESMO GI/World Congress on GI Cancer, which is the actual name, with a long-lasting agreement with ESMO. Mario has been in the past treasurer of ESMO. I've been on the executive board of ESMO, and Dr. Tabernero Gozep is actually the ESMO president, as you all know. So there's a strong relationship, also a history through the persons, through the chairs of the meeting, but also through the collaboration of ESMO. And we are proud to tell you that this is, it's always difficult to tell it from your own, but you can judge that this is the most relevant GI cancer meeting globally. And a couple of strengths, just to highlight a couple of the strengths of the meeting, is that initially the reason why we took the initiative, Mario and myself, and at that moment also Jack Wills, was to have a kind of post-ASCO digestion meeting on colorectal cancer. But then there was a fast evolution and our ideas evolved, and we have a couple of pillars. One is a lot of education, and the educational need for people involved in the management of GI cancer or involved in research in GI cancer is strong. It's a multidisciplinary meeting with medical oncologists, GI oncologists, surgeons, gastroenterologists, radiation oncologists, and you can name it, all those with a focus on GI cancer. So education was important. The second aspect is that we implemented gradually is attracting new data. And as Mario said, we have more than 400 abstracts. Several of the abstracts this year, like in the past also, are brand new data, never presented, not yet ready to be presented at ASCO. We have a few phase 3 studies which are relevant, very relevant for the field and for further evolutions. We have several phase 2 studies, new studies, which will help us also to design further trials in this situation, and they will be presented the next coming days. So that's a strong aspect, and that's what many of the audience like. The other aspect that some of the audience like is also the digestion of data that were presented out of ASCO by the experts, by the faculty, because at ASCO is very big and it's not always easy to digest the data and to do a good interpretation, and this is a good forum. And then finally, what people like and what we have implemented more and more is also some controversy sessions or discussion sessions. We have a couple of tumor boards. We have gradually implemented that more and more together with the scientific committee. We have a strong scientific committee at the meeting, and to have this, and that makes a strength. So education, new data, and interaction on clinical cases, and then new data that are relevant also for the design of clinical trials. So that are some of the relevant aspects and some of the strengths in the meeting, and that's why this is one of the highlights, and that's why we're happy and privileged to chair this meeting.
So thank you, Eric and Mario. So I'm Josep Tabernero. I'm the local host, working at the Vall-d'Hebron Institute of Oncology, Vall-d'Hebron University Hospital here in Barcelona. And as Eric mentioned, right now I'm also the privilege to be the ESMO president. I'm going to perhaps talk a little bit about the reason why ESMO decided to sponsor and co-organize this meeting since 2004. So it's more than actually it's almost 15 years that we work together. And basically, as you know, ESMO has in its main congresses, the most important one, always done in Europe. On this year, this is going to be in Munich in October, and also we have another congress, global congress in Asia, in Singapore. This is going to be the 4th edition. But ESMO understands that it's very important also to have more multidisciplinary congresses with the different tumor areas, and that's why, with the success of the World GI, the decision was taken to sponsor and co-organize this right now World GI, ESMO GI meeting. Because again, this is the natural place to talk about multidisciplinarity, and this is what this Congress is about. You will see in the program, but also in the scientific content, that several abstracts actually are related to the multidisciplinary approach of patients with gastrointestinal malignancies. And again, we are really very happy of the success of the Congress, not only for the participants, with more than 3,000 coming from many different countries, actually up to 90 different countries. But more importantly, as Eric pointed out, is for the quality of the scientific data. This is the organization of the Congress is very flexible on the late-breaking abstract submission process, and this actually provides the opportunity to have late-breaking abstracts that some of them are going to be practice changing, of course, and this is important to offer as soon as possible this information to the whole community of physicians as well as to the society. So again, we are very happy about this 20th anniversary of the Congress. I'm also very happy that the Congress is being done in Barcelona, except for 2 occasions that was not done in here, but since 2001, this is a Congress that it's always held during this time of the year, either late June or July, and in Barcelona. And thank you very much for coming today.
Of course, what we forgot maybe to add is that in the beginning, when we started the meeting, going back to the history in 1999, Mario, myself, and Jack Wills, we sat together with Imidex, as you say in the US, and that has been a partnership evolving over the years, and that is continuing, and we are committed to continue that, of course. There are a few new phase 3 studies that are very important in this, that will change, let's say, the design of future trials or may change the practice. The first study will be presented by Gazep on Thursday, I believe, Thursday afternoon, is a randomized phase 3 study in patients with metastatic gastric cancer failing the different treatment options. This is a very difficult to treat population, and in this study, patients will be randomized, were randomized between placebo or trifluridine dibracil. That's new data. There was a press release recently telling us that the study is positive, which means that there was a survival benefit in the study. So that's one of the highlights. A second highlight is the data presented today by Andrew Zhu from the US. That's the data on HCC in patients with high alpha-fetoprotein. At ASCO, he presented the first data of the REACH2 study. Today, he will develop further that with new data, the combined analysis of REACH, the REACH1 and REACH2 study, which shows it's always good when you see that data from two different randomized phase 2 studies. So that's the second highlight. A third one is a presentation on Friday morning by Dr. Bendel, Joanna Bendel, which will present for the first time long time awaited data of the so-called IMBLAZE study. That's a study in patients with colorectal cancer, refractory to different treatment options, where patients were randomized between standard treatment, regorafenib, or a combination of atezolizumab, which is a checkpoint inhibitor, plus cobimetinib, which is a MEK inhibitor. Remember that last year she presented phase 1/2A data showing clear hints of activity. So everybody in the field also is looking forward to the data, also especially because some other companies and some other checkpoint inhibitors are being combined with some other MEK inhibitors. So this was an old evolving field in this situation. Unfortunately, as you know, the data are negative, do not show that atezolizumab plus cobimetinib is better than regorafenib. Of course, everybody would have hoped that it was better. We will see the details tomorrow. But that's what I alluded to. That's important for the design of new data. And the question is going to be, do other combinations of other checkpoint inhibitors with other MEK inhibitors, do they do the same or they do better? So that's going to lead to a whole discussion topic. And another new data set, a new trial is the so-called TASCO study, which will be presented on Saturday. It's a randomized phase 2 study, and that's a study in patients first-line metastatic colorectal cancer, which are not good candidates for more intensive chemotherapy. And these patients were then randomized between a reference treatment, capecitabine bevacizumab, versus trifluridine tipiracil bevacizumab in this setting. And that's randomized phase 2 study. And as you will see, the data or the results are very interesting and will be the basis for further phase 3 studies. So that are some of the highlights. And then through some of the others, there are updates and new data also being presented. But just to mention 4 of the highlights. One of our strengths is that we cover, let's say, the different cancers from the esophagus to the anus in the GI tract, and cover with a focus on the multidisciplinarity and translational science and translational oncology and progresses. So multidisciplinarity comes back through the different topics. And also new data, translational biomarkers comes back. That's the way oncology is evolving further. But we have always taken let's say, the option to cover most of the different cancers. Some of the rare cancers are then in some of the Meet the Expert sessions, where there is as much interaction as possible. But we don't focus, let's say, 1 year more on pancreatic and the other year more on gastric cancer. We try to have this pattern of covering the different aspects and then looking at which new evolutions come through. And there, of course, translational science. Immuno-oncology is important also. We have, therefore, some keynote lectures also. For instance, Pierre Colli is explaining some of the background on immune mechanisms in cancer as a teaching, as a learning event, because a need that you hear from many oncologists is that they don't understand all the aspects. And that if they use these drugs, these new treatments, they want to understand some of the basis. So we have integrated also some basic scientists through the program, as you've seen. And then another relevant aspect is also some discussions on health economics, access of new drugs. Dr. Tabernero will give a lecture on that. We have on Saturday morning a session also with somebody from the FDA, somebody from the European authorities, and then Dr. Douillard, who is the CMO of ESMO, discussing on how can we have access in an optimal way to drugs in this. So we are quite broad, covering different aspects.
Actually, if I may add something, I think that thanks to this approach, this global approach of covering all GI, we have so many abstracts submitted. Naturally, at the end, we have almost 400 abstracts that will be presented. Most of them, of course, in the format of posters, 340. But then we have 30 orals and 19 poster discussions. And something that may be important for you is that all these abstracts are currently available, except for the late-breaking abstracts, because this is they are embargoed until the end of the session that they are presented. But certainly this shows how important it is to have this multidisciplinary approach, as mentioned before, but especially in all tumor types, and that makes this Congress actually very unique compared to others that are conducted in other places of the world.
From a general point of view, I would say that the success of this whole meeting, especially at the start, is due to the fact that we were very early as organ-oriented meeting. So you had in organ-oriented meeting, if you go back 20 or 25 years, you did not have that much. You had lung and breast, and then obviously in the hematology side it was different. So when we started with colorectal cancer, it was the first meeting just on GI. And then because of the extension of the field and so on, we tried to cover the whole field. So at the present time, you have an organ-oriented meeting on the whole of GI, and then at the same time, and that's what Dr. Tabernero was just mentioning, you get other additional problems that are on top of it, like cost, like side effects, and so on. So when immuno-oncology came, all of a sudden, classical oncologists had to become again general internal medicines, because you have a whole spectrum of side effects that were not present at all before. So we try to cover all that while we are an organ-oriented meeting.
If it's not a secret, why the LBA4 has been cancelled?
Because the events.
You're referring LBA4. That's the or LBA3.
LB3.
LBA3. I guess you mean the pembrolizumab, chemo plus or minus pembrolizumab in first line. Is that the study?
That's the study.
Cancer?
It was all through.
The reason for that being is that there was that happens at every congress. The study is event-driven. You need enough events to occur, and they submitted the late-breaking abstract in case there would be enough events. There is no issue with the study as far as we know. There was a communication that the study is ongoing right now, but the events are not yet there, so it's too early. That's the only reason.
But this is just to make a point on that. This is a regular process that we have with late-breaking abstracts, because you want to present information when it's relevant as soon as possible, and you think that the events are going to be there, but at the time that the events are not there, you have to withdraw that. I mean, this is something that we see in all the congresses that are flexible for the LB8 deadline submission.
We are around all the meeting. If you want some questions to Dr. Ricardo, Tabernero, myself, or somebody else, just reach out. As for the Congress and the program, we're flexible. We are also flexible to interact with you if you have questions on relevant data or on other aspects of the meeting. and or to do interviews or whatever, or help you with reporting.